Dear students, today we are going to see about paranasal air sinuses. So what is paranasal air sinuses? It is nothing but the cavities which are present around the nose parallelly. So what is the use or function of the present of these cavities around the nose? Point number 1, to add phonation to your voice. Point number 2, to make your skull lighter. Okay, fine. How many paranasal air sinuses are there? There are four group of paranasal air sinuses. Number 1, frontal air sinus. Number 2, ethmoidal air sinus. Number 3, maxillary air sinus. Number 4, sphenoidal air sinus. So where all these sinuses are located exactly, if we see, the frontal air sinus is present within the frontal bone between two tables of the skull, outer and inner table. And the ethmoidal air sinus is present just above to the root of the nose in between two orbital cavity. So the maxillary air sinus is present within the maxillary body, and the sphenoidal air sinus is present in the sphenoidal bone, particularly in the sphenoethmoidal recess. Right. So size wise, if you see, the maxillary air sinus is the largest cavity, whereas the frontal air sinus is the second largest cavity, and the third one is sphenoidal, and the least one is ethmoidal. So all these are present as pair except sphenoidal, and the ethmoidal also present as three groups, that is anterior, middle and posterior ethmoidal ear sinuses. So where these sinuses are draining into if it is filled with the fluid. So this picture is to show you the lateral wall of your nose. So in the lateral wall we have three shelf-like projections, that is called as concha. From the superior it is named as superior, middle and inferior concha. The depression or the pit which is present between these concas are named as meatus, are called as supreme meatus, superior meatus, middle meatus, inferior meatus. So these four paranasal air sinuses are draining into these meatuses only. So the supreme meatus is very close to the sphenoidal. So sphenoidal draining into this supreme meatus area, that we can named as sphenoethmoidal recess also. So this superior meatus will receive posterior ethmoidal air sinus. The middle meatus is having two features. One is the elevation in the middle, that is bulla ethmoidalis, surrounded by a depression is known as hiatus semilunaris. So the bulla will receive middle ethmoidal air sinus. In the hiatus there are three drainage. Anterior hiatus receives frontal air sinus. Middle hiatus receives anterior ethmoidal air sinus, and posterior hiatus area receives maxillary air sinus. So what is going to this inferior meatus, if you see, that will receive this nasolacrimal duct which is given in blue color. What about development? So development of all these four paranasal air sinus, if you see, the maxillary air sinus is the first one to appear within 7 to 10 weeks of your intrauterine life from the mucous membrane of lateral wall of nose. It will appear from primitive first infundibulum to the maxillary bone. The second largest is our frontal ear sinus, that will be appearing as a direct continuation of infundibulum and frontal recess. The third one is about sphenoidal ear sinus, that is developed as evagination of sphenoethmoidal recess. The fourth one is about ethmoidal ear sinus, that will be developed from the fold appeared in the lateral wall of nose forms a crust. So all these three types are appearing from the crust from the lateral wall of nose. What about histology? All these ear sinuses are lined by a mucous membrane which has an epithelium, that is pseudostratified ciliated columnar epithelium. So please do follow for the next interesting topic. Thank you so much.